moving testimony. I now recognize myself for 5 minutes. Ms. Ali and Mr. Johnson, thank you for sharing your stories with us this morning. They are heartbreaking. And I'm sorry that our health system, that our American health system harmed you and your families. Addressing our Black maternal mortality crisis will require a systemic shift in our approach to maternal health care and targeted data-driven policies. But right now, we simply don't have the tools to collect the data we need to inform good policy. So, Dr. Taylor, let me start with you. How is the federal government's data collection on adverse Black maternal health outcomes lacking? Dr. Taylor.
Yes, thank you so much for your question, Chairwoman Maloney. Right now we still have a fragmented system in terms of collecting data in this country. And so, the best that we can use or what we see coming out of the CDC is basically an estimate. You've heard a lot today from our colleagues about the need to advance and ensure better funding for maternal mortality review committees. And that is going to be key to make sure that we have more accurate data. The Preventing Maternal Deaths Act was passed in 2018, and that bill allocated additional funding for states to develop and start maternal mortality review committees, but we still don't have them in every state. And so until we do that, then we will have more accurate data, both in terms of race and ethnicity. And we also need to know what the impacts are on these communities, both from a qualitative level as well as a quantitative level.
Thank you. There are a number of bills that have been introduced in the House that would improve data collection. For example, Congresswoman Kelly's Mamas Act would standardize federal data collection and reporting on maternal mortality rates. And the Data for Moms Act, part of the Momnibus package championed by Congresswoman Underwood and Adams, would foster improvements in data collection practices and promote diversity and community engagement in maternal mortality review committees. So, Dr. Creer-Perry, how would better data collection reduce Black maternal mortality and morbidity in the United States?
Yeah, thank you. So we know that during the COVID pandemic, there was a highlight of the need for data, right? We were sending resources to places based upon bias. We were hearing words like it's the Chinese virus and all those biased, and so that made our infrastructure shift. This is the same thing that happens when it comes to Black maternal health. If you don't have the actual information, you're going to create solutions not based upon what's really happening. The beauty of us having finally the data released by the CDC after the testimony that Charles and I were able to give to increase funding for the CDC to help support states for recording showed that Black birthing people were still 5 times more likely to die in childbirth despite having an advanced degree. That's the kind of thing that you need in order to be able to then say, so don't just blame them and say go to school and your outcomes will become better, because we go to school and we still die. So we need to have data so they don't operate out of bias when we create policies and strategies and investments, just like we had to do during the COVID pandemic.
Thank you for your excellent answer. I was pleased to join my colleagues on the Oversight Committee and in the Black Maternal Health Caucus earlier this week in asking the Government Accountability Office for 3 new reports that were crafted from the Momnibus legislation. And these are the 3 reports that we've requested. The first will examine how the coronavirus pandemic has exacerbated America's Black maternal health crisis and how our efforts to build back better are impacting these outcomes. The second will analyze the state of our country's perinatal workforce, including barriers to accessing care by midwives and other maternity care professionals. And the third will evaluate how America's Black maternal health crisis disproportionately harms people who are incarcerated. In each of these requests, we ask GAO to assess how limitations in data collection inhibit their abilities to draw conclusions. This will help us to understand what we still do not know. Mr. Johnson, let me end by asking you, What do you hope will come out of this hearing today? Your mic is not on.
Anybody? There we go.
Now we
Okay.
hear you.
Okay, here we go. So, thank you, Madam Chairwoman. Let me first say, as I expressed earlier, that although the statistics and the stories that we are hearing are devastating, what I want you to understand, and I want all the members of this committee to understand, is that on behalf of the families that have been impacted by this crisis,